Hello students, welcome to this session of Introduction to Sociology under the Medical Sociology. So in this session, we're just going to look at basic sociology concepts so that we build the background of sociology as a course. Okay, so when you look at this slide, you can look at people putting their hands together. Okay, so in sociology, we basically study people and how they interact. We are going to look at basic definitions for sociology and more concepts. So with sociology, we basically look at the environment that people live in and the people and their belief and everything that they accept as real or to be a standard or an ideal way of living. Okay, so whenever you hear the word sociology, you should basically look at individual in the environment, who they interact with, what they consider to be important, what they consider to be immoral, what they consider to be bad manners, what they consider everything that is around them. That's sociology, just the word sociology itself. When you look at this slide, we want to understand what sociology is. We are basically going to drive the fact that in sociology, it differs with it also involves beliefs and understanding. Some levels of education influences everyday's choices. Okay, we can look at two people with different perspectives. There are people who are definitely going, whenever they are sick, they are going to go for herbs, and there are people who, whenever they are sick, they are going to modern um, things like going to seek some medical attention from the health facility. So all this exists within society, where there are people, how they interact, what they think, what they believe in, what they respect, what they consider to be moral, what is considered to be immoral, punishments, rewards, and everything that is around there. So in this side is depicting two different kinds of people. When they get sick, the other one would go for helps, the other one would go to the hospital. So this is sociology. We want to understand human behavior. Okay. We want to understand the basis of human behavior, everyday choices. What influences everyday choices? What influences the way we think? The symbols that we've categorized in whatever aspect. Okay. So with this session, we are going to focus on the following learning objectives. We want to define what sociology is. We want to also define what medical sociology is. We want to study the importance of medical sociology, and we want to get the brief history of sociology. Okay, so now let's start with defining what sociology is. What is sociology? Sociology, we can look at it as an evidence-based human science. Get me correct? Human science, shared experience, and the diversity of experiences, theories, and methods. Systematic study of groups, institutions, social structures, culture, social interaction, patterns of behavior. So when you look at sociology, this is basically it. We're looking at it's the evidence-based human science. We want to understand a human being. We want to understand what will influence this other person to go to seek helps and what will influence the other person to go seek for modern. So in sociology, we say that's not a coincidence. It's something that is within the particular person. It's something that is within the society. It's actually something that arises from what is considered to be normal, what is considered to be abnormal, what is considered to be moral, a lot of factors that we can mention here. Okay? So we have shared experience and diversity of experiences. People have lived from centuries to centuries, from generation to generation. So they have experience. They have some theories and methods. They have theories attached to how they respect something, how they define something, how they define respect, how they define values, how they relate to customs, how they relate to norms of the society, basically. So, sociology is the scientific study of society, social relationships, social institutions, and pattern of behavior. This is a definition of sociology. It's the scientific study of society. We want to study society, okay, through observations and experiments. That's what we mean scientific. We don't just want to make inferences using our judgment or experiences. We want to study society scientifically. We want to do experiments. We want to conduct research. Okay? We want to define society on verified information. That's what we mean by scientific study of society. Social relationships. The relationship that exist, it could be intrapersonal as well as interpersonal. The relationship within yourself and the relationship with the other person. That's interpersonal. Social institutions that exist within society. We have a lot of institutions. We have churches, we have schools, we have courts, we have a lot of things that exist, and patterns of behavior. How people interpret things matters. It examines how individuals interact with groups and how society influences behavior. Sociology studies structures such as family, religion, education, economy, and health care. This is sociology. This is sociology. So now, we mentioned to say that sociology is considered to be a science. Have you wondered why sociology is considered to be a science? Is sociology involving the digestive system, trying to understand things scientifically, for example, like understanding the alimentary canal, understanding the, let's say, understanding mitosis, understanding classifications of animals? Does it really involve it? So what do we mean when we say sociology is considered to be a science? Remember I said it is based on, it should be based, or whatever that sociology has brought in, it is based on experiments and verified data. So when we say sociology is considered to be a science, we mean it uses systematic and scientific methods of study, carrying out research on human behavior, carrying out experiments on human behavior, so that you make conclusion. That is, you are using the scientific methods. It relies on observation, data collection, and analysis, not just on experience and personal judgments. Sociology should not be based on experience and personal judgment that you as an individual is going to make. It relies on observation, okay? Data collection and analysis. It develops theories to explain social behavior. Theories have been developed to explain why some people behave in a certain way, okay? Uses empirical evidence, not guesswork. When you are using personal judgment, it's guesswork. When you are using experience, it's guesswork. So we want to use empirical evidence, not guesswork. Findings can be tested and verified in sociology. A lot of experiments have been done. It helps predict social trends and outcomes. Okay? How things occurs in society and what emerges. It helps us to understand all those kind of things. So this is the reason why sociology is considered to be a science, because we use the scientific method as well as other systematic ways of study. I believe we're together there. So now we have looked at what sociology is and why it is considered a science. Now I want to look at what is medical sociology. What is medical sociology? So the concept of medical sociology exists the fact that with sociology, you're understanding the interaction of human behavior. But this behavior is going to be studied in various branches. Like medical sociology, we specifically want to integrate sociology with the health. Okay? If we want to understand we want to learn sociology in business, it's about how to take care or save the customers. If we want to talk about the sociology of other fields, we want to specifically link that field with why sociology can work. Okay, so now, what is medical sociology? With medical sociology is the study of how social factors like education, income, okay, etc. How social factors influence health, illness, and healthcare delivery. So we want to look at how the social factors that I've mentioned, for example, education, income of the person influences health, their own health, illness, and healthcare delivery. So when you look at this slide here, you're looking at two different pictures. On the left is the witch doctor, and on the right is the medical doctor. So now we're looking at how social factors, this is not the conclusion or the general conclusion on everything. This is just a minor example on what we mean. Between the witch doctor and the medical doctor, what is going to influence your decision? Where are you going to when you get sick? Are you going to... So in situations where you find that someone is going to the witch doctor, depending on how they understand their disease. If they understand their disease to say the cause of this disease is due to some kind of evil spirits and everything, then probably they are going to the witch doctor. If they understand that malaria is caused by witchcraft, they are going to the medical doctor. That is, their education levels is low. But if they understand that malaria is caused by mosquito, they are going to the medical doctor because they know that this can easily be treated by quarter. So basically everything that goes around how social factors, like the way I've explained social factor, one of the social factors that we have used here is levels of education. Someone is going to the medical doctor, someone is going to the witch doctor. Apart from that, what other social factor are we talking about? We are talking about income. If at all they know that they are having this condition, let's say they're having cancer condition that is requiring them to do a surgery of 25,000, and then there's a witch doctor who is just charged them 2,000 that they are confident that they can cure cancer. Because of the low income levels, they are more likely to go to the witch doctor and not the medical doctor. So there are a number of social factors that influence how we understand health, how we understand illness, and what healthcare delivery are we going to get. It explores how society shapes disease pattern, health behavior, and health system. Examines interaction between patients, healthcare providers, and institutions. Because in the medical field, it's not only that doctors and nurses and pharmacists and other like radiographers, physiotherapists, among others, are not the only people who are going to interact. Okay, they are not the only people who are going to interact. They are going to find bedsiders in the hospital. They are going to find bedsiders are the caretaker, the ones who are looking for the sick, and they are going to find the patients. They are going to find fellow health workers like drivers. They are going to find other people who are working in that particular area, different plumbers. How are you going to interact with those particular people? That's what we're concerned in the medical sociology. I believe we're moving together. So the social factors that I earlier mentioned some, we talked about education, economical stability. We also have some social and community context. We have neighborhood, the environment, and healthcare. These are social determinants of health. Importance of medical sociology. Why is medical sociology important? It explains social factors affecting health. Remember on the social factor that I mentioned, social factors affecting health. For example, if someone is having low income and they have to make a decision, what are they going to have access to the health of that particular person? They are not going to have access to effective treatments. Okay? The economical status, maybe people cannot afford the clean water. They are more likely to persist suffering from diarrhea and everything. So explain social factors affecting health. Dirty water, low income, low levels of education, all affects health. How you understand health helps understand patients' behavior. So sociology helps us to understand the behavior of the patient. You try, for example, you try to understand, you understand their culture. Okay? For example, it could be in a situation where understanding the patient behavior, it could be in a situation where maybe a woman in labor has refused to be attended by the male nurse. Probably, maybe in their culture, they believe to say that the birth attendants should be women. That's the normal thing to them. So you should not be judgmental and judge them. Just provide a female nurse so that they can attend to them. So at that particular time, it has helped you to understand the behavior. That way, they are going to think you have received them and they're going to receive the care that is well respected. Improve doctor-patient communication. Understanding yourself and understanding the patient's behavior will create understanding, better communication between you and the patient. Okay? If at all you understand the behavior of the patient, you are going to have better communication there. For example, in a situation where we have some religion which do not allow blood transfusion, getting the other person's blood and putting into another person's blood. So we have some religion that does not allow that. So if you understand, you are going to communicate to the patient and help them in a different way. If at all they can be convinced, the better. Addresses health inequalities. With sociology, we understand that there are some people who live in the urban, there are some people who live in the rural areas. You find that there is compromise or inequalities in health because of poor delivery services to those people who live in rural areas, or for them to access just for them to reach the general hospital. You find that they are traveling kilometers and kilometers. But those people in the urban, they are just maybe walking and reach the hospital, using 5 minutes and reach the hospital. So we want to address all those health inequalities. Support effective public health programs. Okay? This comes in as a mutual understanding. It's only way when you understand the culture and beliefs of society, that's where you are going to interact with them and you are going to improve communication between you and them. Promote culturally competent care. Culturally competent care. I gave an example earlier to say, in a situation where maybe a woman in labor has refused to be attended by a male nurse, probably that's the belief that they have in society, they can be attended by a woman that is a female. So instead of arguing and being judgmental, just solve the issue in a calm way. So those are the importance of medical sociology. So now let's look at brief historical background of sociology. Where did sociology emerge? Why did people start studying the human behavior, the social factors, interactions? Why did people start doing this? So Sociology emerged in the 19th century, and this in the 19th century it was influenced by Industrial Revolution. This Industrial Revolution, we're going to look at it. It came as an influence of growth of cities and factories. So look at the Industrial Revolution. Industrial Revolution led to the growth of cities and the factories. People in the past never really depended on factories for them to have income or for them to eat or for them to provide to their needs. However, with the move of time, people started working in factories. When you look at people in the past, they just used to hunt and everything and provide to their basic needs. However, with due to time, there was introduction of what? Of some industry. People started looking for high quality of life. Due to the development of cities, people moved from villages and go to the city so that they can, in seeking of a better life. So this is the industrial evolution. Within those cities, you find that there were different inequalities. You find that in the cities, there are people who owned the companies, there are people who are working for the owners of the companies, and there were actually people who are actually even in lower classes. So now the issue of classes now allows to say that there are some people who are living better life. For example, political ones. There are some people that's where now classes emerge to say that this is an upper class, this is a middle class, this one is a lower class. All those existed because of industrial evolution. People were no longer depending on hunting, but they were depending on factories to produce goods and for them to have their income and have access to their goods, the needs. Okay, so industrial evolution is one of the factors that contributed to the study of sociology, because the classes emerged. People used to live different areas. People used to be affected by different life conditions. The poor were being affected by these conditions of, let's say, a poor sanitation, for example, like diarrhea and everything, dysentery and everything. So people saw the need to understand sociology, what really happens in human association as well as their behavior. So growth of cities and factories. When you look at the Sun people, they used to live in caves and everything. They never really had life above caves. They would only wake up, go hunt, and come back. No life goals, no everything. But from the time people introduce the system of building nice houses and everything, the cities, people can work in, they introduce those things. Then classes emerged. Diseases started to be there. Health, seeking care, everything. The other factor that led to the study of sociology, we have political revolution, specifically the French Revolution. Okay, so the French Revolution brought also about the scientific thinking. They need to understand social disorders and change. Okay, what really affects how people live and everything. What brings disease? What brings illness? Okay, such factors. So that was political revolution. So now let's look at how the French Revolution occurred. One of the most famous flashpoint of the French Revolution is the storming of the Bastille. So what happened with the storming of Bastille? The storming of Bastille, the Bastille used to be, in the French, used to be the shield for French people during the wars, the Crimean Wars in those 18th century and everything, the time when the war were there. Okay, so this was used to act as a protective barrier to protect the people. However, with the move of time, the kings started practicing dictatorship, and people were led by those rules. People had no human rights and everything. Then they used this Bastille to arrest those who were doing crimes. It started acting as a prison. But people realized to say that these people are oppressed because some people were in prison on unfair trials. So some people were there due to accusations and there were no fair charges. So people realized today that this is not how people should live. They teamed up and stormed the Bastille, and every prisoner who was there was rescued. So this is the French Revolution. Now, what did the French Revolution bring? The French Revolution brought the people now to start understanding rights, for people to start understanding power, for people to start understanding democracy, people to start understanding choices. So now the study of sociology became even broader because there were now a lot of things to look at. Okay, so now let's look at the major sociologists. Major sociologists who did most of their studies in sociology. So we've said that the history or the introduction of sociology came as a result of those two things. However, they are not the major ones. We have the Industrial Revolution. People started developing, understanding cities and everything. Factories emerged. People started living better lives. And then now we came with a political revolution, which is French Revolution. People started understanding their rights and everything, right? So now I want to look at these major sociologists and their contribution in sociology. We are going to look at them one by one. So we have Auguste Comte, who lived in the years of 1798 to 1857. So Auguste Comte is known to be the father of sociology. He coined the term sociology. He's the founder of sociology. He's the first one to start understanding human interaction. He's the first one to start understanding how people behave and what affects people's behavior. He introduced positivism. This positivism was just an emphasis on observation and experimentation. Whatever you observe from society should not be based on being judgmental or experiences, but it should be proven, verified information. Divided sociology into social statistics and social dynamics. We want to look at Emile Durkheim. His work was recognized in the years of 1858 to 1917. He established sociology as an academic discipline, meaning Emile Durkheim, Auguste Comte just came up with sociology so that people can understand to say that some behaviors emerge from somewhere. So social interactions, what is considered to be culture and everything. However, with Emile Durkheim came up to say sociology should be studied. It should be an academic discipline. Introduced concepts of social facts. Studied social integration and cohesion. How people relate towards each other and how strong the bonds are in between. This is integration and cohesion. The famous work for Emile Durkheim is Suicide. He described or defined 4 types of suicide. He linked society to individual behavior. Now, Emile Durkheim looked at how society affects an individual. If people are living together, how is what they believe in, norms, customs, laws, customary laws, and everything, how do they influence this particular individual? We also have Karl Marx. who made his was famous in the years of 1880 to 1883. He focused on economical system. Karl Marx introduced the concept of class struggle. He's the one who realized to say that within this society, some people are having much stable income. Some people is just moderate. So introduce the concept of class struggle. He's the one who studied 3 class system. Okay. He studied the upper class, middle class, as well as lower class, and he described all of them. He divided society into bourgeoisie and the proletariat. These 2 terms, the bourgeoisie, these are actually people who owns factory. Those people were owning factories. And the proletariat, these were people who actually were working, or rather the employees who are working for the bosses, the bourgeoisie. Okay. He highlighted inequality and the exploitation. So just like in today's society, you find that people who are actually working for other people are actually get to be exploited and get little money. So those are the inequalities that exist. Believed social change occurs through conflict. Okay. So on the fact that he believes social change occurs through conflict, Karl Marx realized to say that if we have people who are owning factories, the bourgeoisie, and the proletariat, the ones who are working for those bourgeoisie, then these factory owners are producing poor working conditions for the workers. Then the workers protest, okay? Protest for bad working conditions or maybe low wages and salaries. That is the only way that the owners of the factories can try to improve their conditions and increase the salaries of these workers. So all this time, Karl Marx was looking at the studies to say that that conflict is what causes social change. He influenced conflict theory. With the conflict theory is the start to say that people actually fight because of inequalities and few resources that are actually available. So the few resources that are available, people actually fight for them. That is Karl Marx. Then we have Max Weber. His works was known in the 1864 to 1920. He studied the role of culture and religion. He went now to understand what is culture and what is religion. He introduced the concept of social actions, emphasized interpretive sociology and not just based on experiences or judgments that are lacking evidence. He wrote The Protestant Ethics and the Spirit of Capitalism, links ideas to economical behavior, focused on the bureaucracy and the authority. So this is Max Weber. And before I actually finish, let me also talk about Herbert Spencer. What was known about Herbert Spencer? Herbert Spencer also made contributions in sociology. He introduced the concept of survival of the fittest. Survival of the fittest. Survival of the fittest. Okay. So Herbert Spencer introduced survival of the fittest. This is the most famous work for Herbert Spencer. Herbert Spencer got this concept from Charles Darwin. Charles Darwin is the one who coined the concept of social Darwinism. On social Darwinism, he was explaining the fact that people, only those people who have better abilities are able to produce better things. People with better abilities are able to produce better things. So now, from Charles Darwin, Herbert Spencer also made these inferences to talk about the the survival of the fittest. Okay. However, with Charles Darwin was just describing to say that if at all components are supporting something, then it's more likely to have better outcomes. For example, he described sociology as just like any other living organism. If at all the liver is working well, the lungs are working well, the kidney is working well, then the patient is more likely to work effective. But if these are not working well, then the person cannot be at their peak. So Herbert Spencer got the survival of the fittest to say that only those who deserve it are more likely to get it. However, there were a lot of criticisms to survival of the fittest because survival of the fittest was deemed to be the concept that looks at the fact that they were trying to support or justify the inequalities that exist within society. Because survival of the fittest means only those who do their best or those who works hard are going to get it. But we have a lot of people who works hard but they are in lower positions. And we have people who are in higher positions because they just have family connections and other things. So survival of the fittest was criticized because it was more like a term coined that justifying the inequalities that exist in society. However, survival of the fittest does not necessarily work in that particular way. So that's something about Herbert Spencer. His famous work is on the survival of the fittest, of which it is not well accepted in sociology because people believe to say he was trying to justify inequalities that exist within society. So this ends of this session, and if you have reached this far, it means that you are enjoying this particular tutorial. Just make sure that you subscribe so that you don't get to miss any content that is posted on this channel. And the line is there in case you have any other challenges. It could be that you are from any institution. It could be that you are from Eden, you are from Apex, you are from Murungushi, you are from Copperbelt University, you are from the University of Zambia. Just reach out to me using that number. Thank you.